Thank you, Dr. Segre, for joining me this afternoon to talk about the work that you did at NIH to defeat the superbug that went through the NIH hospital. I guess it's been a couple of years ago now. It seems like you and the team were given a somewhat impossible task. Every effort to defeat the outbreak had been failing until your team stepped in. Where did you start?
Dr. Palmore and I started working together at the very beginning, but as is true for many of these situations, in the initial stages, we really didn't understand the complexity of the issue that we were facing. There were two equally likely scenarios. One, that two different patients had brought the same bacteria into the hospital, and that perhaps our methods for detecting this bacteria had gotten so much better that we had now picked up a second case, or that possibly there had been a transmission in the hospital. And those are two equally likely possibilities, but science could answer that question. We had most of the pieces in place, but it was sort of about slotting everyone in and kind of going to every person and saying, this is the most important thing I'm going to ask you to do, and I really need you to come through for me. And I know you're doing something really important, but please put that aside for the rest of the week, for the rest of the month, and just work on this. Because we did feel the urgency. There were patients' lives at stake. And we had never tracked an outbreak in real time. So we knew we had all the pieces of the puzzle, but could we bring them together fast enough to combat the spread of this infection? And so we started from the very beginning. We certainly improved our speed as we went through the cluster of infections. But we were engaged from the very beginning. It's just that no hospital had ever addressed this type of multi-drug resistant bacteria with this level of devotion.
So, and maybe you've answered this, but at least as I understand it, there are other teams that had tried to do something about the outbreak and didn't quite succeed. What is it that you and your team did differently to tackle the problem?
One of the most important features was really strict adherence to the CDC guidelines. So those guidelines are there, but they need to be, reinforced. What was different about our investigation was that we really brought the full resources of the NIH, which is a hospital in the middle of a research community. So we had patients who were severely ill, but in that same building, in that same campus, we have DNA sequencing instruments. And so traditional microbiology that would be run on gels or plates, you couldn't distinguish between, is this the same bacteria shared by these two patients, or are they separately with two different incidents have they become infected? It was really the integration of the basic science, the tools that we built to sequence DNA from the human genome, that we just turned around and we sequenced the bacterial DNA. It's the integration of the clinical and the basic research that was the novelty that really did give us the tools we needed to investigate where have the weaknesses in the system been.
So you've clearly found a kindred spirit in the work that you two, and I know the two of you continue working together. How do you replicate that or even other critical success factors with the other folks that you need to work with in order to achieve the goals you have at NIH?
I do think that multidisciplinary teams are something that is mentored. It is hard to write it down in a manual and say, this is how you build a team. But I think because we have a training environment where we bring in medical residents, postdoctoral fellows, they all become part of this multidisciplinary team. And they can then go out, and a postdoctoral fellow in my lab can go out and find his own Dr. Palmore when he moves to another medical center. And they can start to nucleate these same ideas of how you bring together teams and address what are the common, what's the mission, what's the vision, what's the role for each individual in building the team, and what does every individual gain from the team. In fact, I have been following the Ombudsman at NIH, Howard Gadlin, wrote a field guide for team science. And before I started working together with clinicians, I actually read that entire book, and Howard came in and did led a monitored discussion with the entire group of what is the mission of the project, and the vision of the project, and the vision for each individual. So I think there are field guides that you can use for understanding and writing down what's the criteria for authorship on a scientific paper. How are we going to address issues that come up in the future? How are we going to decide if something is a team project or an individual project? So there are things that you can learn, but a lot of what you learn still is mentored by belonging to one of these multidisciplinary teams. And then you can replicate that as you move forward.
Be clear about your goals, your roles, and train the next generation. That's good advice for any team. Thank you so much for sharing your lessons from this experience with us this afternoon.